people have been interested in asking about the mouth shield, and this makes the flexTAP, the other taps that have a mouth shield, absolutely unique. Every other device, even CPAP, all they are looking at is the anatomy, and what we call pre-crit is the collapsibility of the airway, and that's the anatomical part of obstructive sleep apnea. Nobody is looking at the ventilatory control of breathing. And we know that if we breathe through the nose, there's a lot of benefit to that. What I'm seeing is that the mouth shield addresses all of the phenotypes that we have been concerned with, whether it is loop gain, whether it is neuromuscular drive of the tongue, or whether it's hyperarousability. So you wear a mouth shield, it increases the CO2, which reduces the hyperarousability. CO2 calms people down. It is a not sympathetic, it's a parasympathetic breathing through the nose. Our respiratory drive is entrained by our nasal breathing, so we have a much calmer, steady nasal drive. The CO2 decreases loop gain. It has respiratory drive in it, and it also makes people feel better in the morning. They sleep better, and they're not breathing through their mouth. That is one of, and maybe the most unique thing that has changed this, that no other device has. And there has been a new study recently showing where a number of different appliances were used, and they taped the mouth shut on those on those older appliances, and improved their outcomes in all of those. So it looks like that in many cases, wearing an oral appliance, people do breathe through the mouth, and that it benefits greatly in a number of cases by having a mouth shield. One of the most unique things that I've seen, and we've had a number of cases and would like to get a study on, is that it improves people that have AFib, and it's really a unique finding in this. So this is some of the studies that we will be doing, but from a comfort standpoint, and people, they come back and say that makes a big difference.